Hi, this is Kimberly. Please enjoy your podcast, but remember our doctors are only here to educate, not diagnose. If you have any questions or need any further information, please email me. My email address is kim@mfwellness.org.
All right, best friends, we are back on the scene. Once a quarter or maybe twice a year, we take time just to answer questions from patients. And so we call it the round robin. And it's basically all the questions that we've been fielding from patients. Not all of them, because we get a lot, which is something I wanted to lead off talking about. There are offices and places where if you go in, there's like a sign and it says you can only ask one question or whatever.
Ew, really?
Yeah, they're medical offices, and I'm assuming chiropractic ones too, where they're like, hey, your doctor only has time to answer one question. You have to ask another. If you have another question, you have to make another visit. And I just don't even know where to start with something like that. If your physician can't immediately answer the question to the point where you're sick to your stomach, just destroy you with knowledge. I just don't know what you're doing.
Where the patient just wants you to stop
talking.
And immediately regret asking the question.
I will talk until you walk away from me. I want to make sure you understand what's going on because it's your health. And somebody was talking about it this morning and I couldn't believe it. But that is true, that they're like, there's a sign, apparently, at the front, like, hey, you can't ask more than one question. Like, are you kidding me? Anyway, what we want to do is just go over some of the questions we've been getting lately from patients. In case anybody has those, we can answer them. That way, when you come in to see us, you can ask us new and better questions. I guess if somebody has a physics question, I guess if it's in my field.
Sure.
Yeah, so anyway, I just wanted to lead off talking about that. Like, if you are limited in how much think about the premise there. Hey, no matter what you care about, you can only ask me one question. Like, how is that supposed to be the gateway to health? That you're limited in the question you can ask. Hey, you have questions about your health? You have to decide. Do you want to learn more about fat burning or do you want to learn more about a proper diet? Because I'm not answering both questions today. Like, are you kidding me?
Yeah, that's crazy.
Are you kidding me? It makes me a little crazy. So anyway, who wants to go first with their round robin?
I can go.
Dr. Maurer is going to go first, Kim.
So one of the biggest things we like about our new office and how much room we have is the fact that we have 8 adjusting tables.
They're everywhere.
All in a row.
I love it. And a new one on the way.
And that is true, yeah.
They're producing it. It wasn't me that interrupted Dr. Maurer this time.
Don't look at me.
I'm just
I feel
saying,
like
it wasn't
it
me.
was.
Yeah, it was. All right, go ahead. Sorry.
All right. So a question we get a lot, not only from the patients, but I feel like from their family members or friends. They bring in, a lot of times they bring in their friends.
Oh, I love it. And they're over there like in the gallery watching.
But they're looking at these tables and they see their loved one on this table, and this table's moving up and down, like their legs are moving up
like
and
a
down.
crayfish.
And they're always like, you can see it on their face. So sometimes they ask us, but sometimes we see that look on their face. So we ask them.
Yeah.
Right? So what do you think that
What do you
table's
think?
doing? And usually we do get correct answers. It's just not the best thing that those tables do. So usually, let me back up a little bit. So our tables are flexion extension, and some of them also have distraction, which I'll talk about later, but that leads to decompression. And
It's a gateway drug.
yes,
It is.
that is true.
It is.
So you see your loved one on the table, right about waist level, their legs are moving up and down.
At their pelvis.
Yeah, and then some of them, once they get on there, all of a sudden we're like pulling them apart slightly.
Slightly. Millimeters at a time.
Slightly.
Yeah.
And we even like hook their legs in so they
Right.
can't leave. So a lot of times when we ask people, well, what do you think that does? They do give us, like I said, they give us correct answers.
Yep.
They say, well, it's probably warming up the muscles or it's stretching the muscles, which it is doing that. That's true.
That is happening.
And because it's giving this passive stretch. Some people, they can't necessarily go out and do stretching. They're in such of a shape that they can't actively do that. So it does provide a passive stretch for them. Increases the flexibility of the muscles, the ligaments, the tendons. Increases their motion in general. And then some people say, well, it's probably to reduce the pain in the muscles. And it will do that as well. But the biggest thing that these tables do is 3 things I'm going to talk about. One is increasing the posterior disc space.
Nice.
So those intervertebral disc spaces.
Nice.
Sometimes you hear us call them the disc height. And side note, pretty soon we're getting, June 1st, we're getting a stadiometer
Yeah, man.
Sonar based.
I have to not talk about it because
Yeah.
I get
And we'll talk about it more when it comes here, but I'm sure on podcast.
Pumped up, man.
But it's going to get, using sonar, it's going to get the height of every patient. And what we're looking at is, and it might be just, it's going to be millimeters, centimeters.
It's a hundredth of an inch or a tenth of an inch.
Yeah.
I think it might be a hundredth of an inch.
We're going to be looking at when that patient starts, how tall are they? And then, as they go along, 6 months from now, hey, have we added to their height?
Right.
And looking at the disc space
Right.
height change.
We try to control for as much other things as possible, but like the raw data is going to be there.
Yeah.
We've got people like our one floor layer. He was 6'2". When he came in, he was barely 6 feet tall. Now he's over 6'1".
Yeah.
It's pretty awesome. Like with tall guys, they've got a lot to, their percentage.
And just posture in general as well.
Pretty cool, Kim.
So we're increasing that disc space, and what that also allows is for the flow of blood, oxygen, nutrients.
Nutrients.
And I guess a big word we might use is imbibition.
Imbibition,
Can you look that up? So it's helping with that. And sometimes you might, as you're stretching, you might notice us come along and we'll actually use our hands. We're kind of helping that machine open those disc spaces.
It's very focused distraction.
Yeah.
I love it.
And then another thing is stenosis. Mm-hmm. A lot of people that come in, they hear that word, and it's a scary word.
Scary word.
It's like, I got the stenosis. And what it really means is that spinal canal has been narrowed for some reason or another. And where these tables come in, or they help the most, is when that disc is actually protruding into that space. Now, it could be other things. It can be bone, narrowing that
bone
space.
spurs and such.
A spondylo. But especially when it's that disc, these tables can help out a lot with that, and just reducing that pressure. And ultimately, that's what you're going to feel is when that disc gets too much pressure, bulges out, hits nerve, we get that whole domino effect. So that's the biggest reason we use those tables, is that it's relaxing, it stretches the muscles, but ultimately the biggest deal is it's helping decompress. That's our ultimate goal. It's distraction, it's traction, but our ultimate outcome is decompression of those discs. Some of you have been to chiropractic before. Maybe you've had the manual decompression done.
I remember doing that. That's how long I've been in practice.
Cox flexion. Now that's great.
COX, Kim.
But we were just talking about the number of people we have rolling through here daily, and if we were doing that manually,
we'd be dead.
Yeah, we would be getting therapy.
Is that like when the chiropractor has like a really crazy looking table in a room by itself? Is that what
There's a bar. They're holding on to the bar, and
Kim, I don't think that's chiropractic at all. What you're talking about?
They're actually doing that motion that we do.
You're talking about the machine where you get strapped in and it has ankle stop. It's a big, huge machine.
Yeah.
That is the DRX Megatron.
Yeah,
4000.
so when decompression, when they first figured out, hey, we can get these discs under control, there's a way to do this by decompressing the spine. Their first thought was, well, if it's that's right. If
like
it's
literally pulling you apart.
If it's the lumbar spine, let's just decompress the entire lumbar spine. Some people got great results. Most of the people we have talked to that show up here, they did not, because it's pulling the whole thing.
Yeah.
The difference between that and what we can do is that we can go
a continuous time, right?
Yeah, for a while, but it's that it's unspecific. It's not, let's get the whole lumbar spine. Well, there's 5 discs in there, man. Like, you can't just start pulling on the thing. And then what are you anchoring on? The thoracic spine? It's not made to take that. So they strap them down and this and that. What we do is specific, down to millimeters.
Like when I was mentioning using our hand, we've already taken the X-rays. We know where that disc space narrowing
where
is.
to press and
we know exactly what
where not to press
and where not to. Yeah, exactly.
That's the difference. It's the specificity.
Gotcha.
That's what makes good care.
Ours is the
good
flexion, extension, and technically distracting.
Yeah, and that
to
wasn't
get that
done.
decompression.
Yeah, those tables are not that technology for having that cylinder. That's not 5 years old. The first studies coming back where they were doing, chiropractic care, manual decompression, focused decompression with a table that wasn't like a manual table with like manual decompression, but an automatic table with a cylinder. That was like 2016.
Yeah. And some of you may not know, who are patients here, is that we have those 8 tables, and other than maybe 2, they all are a little bit different.
Right.
4 of them right now are just the flexion extension.
Right.
The other 4 are flexion extension with distraction,
Right.
retraction to accomplish that decompression.
Yeah, every table can do every body. Every table can do pregnant. Every table can do.
There are some tables that they don't have a breakaway piece for the midsection.
Oh, okay,
So
there
there's
are.
like 2 that it doesn't have enough. There's not enough support.
Okay,
for that.
cool.
So maybe there's 2 of them, but
All right.
So our disc people, like they don't really get a choice. You know, they're
Well-
getting those new tables we have.
Absolutely.
We had
2018 we started first table. That very first one got here, maybe 2018.
Yeah,
We
other than the one
I don't
Dr.
think we.
Matt has had for.
Oh,
many
yeah.
years.
yeah, the
That's
research
right, that's
the
right.
research for decompression and other stuff is more recent.
Sure.
But there have been the Hill table that I got in 2004 when I graduated is one of the decompression guys. So,
Gotcha.
But yeah, but that's more manual and it isn't auto. So they've
Right.
definitely come far.
it can do it. It's just not built to do it. Cool.
And there is a manual therapy for Big Bertha
Yeah,
to get her.
where you
there,
can
so-
do the lateral.
Yeah, she has
You
everything.
can swing it out lateral.
She does.
Oh my
She
god.
moves up and down too, doesn't she?
She does vertically, yes,
for the tall.
and the
tile
small.
chiropractor.
Yep.
Yeah.
Nice
Sure.
Pretty nice table.
I don't know. I've never used it. I'm afeard.
Dr. Josh doesn't really like to talk about it. 'Cause
I'm afeard of it.
he's
You know, I just it'd be like. I'm like, are we on a train? Like, should I put more coal in the
got-
the
yeah.
burner?
When those
Do we have enough steam pressure?
pneumatics.
when the pneumatic starts going off, he's
Hydraulics
looking for his nail gun.
I'm like,
He's
yeah,
like,
I'm
oh,
like,
yeah, I'm trying to look at it. Oh,
I'm like,
Trim?
is Darth Vader
Put on some
here?
trim?
Like,
Yeah.
what's happening? Yeah,
PTSD.
I do. I guess I do. Yeah. Yeah. All right. Very good. All right. Are you going next, Dr. Fink?
I can. Yeah. So the other question we got was, what's the deal with these weird-looking devices on the other side of this half wall? And what they're referring to is the traction units, the cervical traction units.
Mm-hmm.
Now, we have 2 different phases of cervical traction, phase 1 and phase 2. Phase 1, we put you on the cervical traction units, the blue half moons, and we put ice underneath your neck. Now, the reason why we do that is to get you used to having a force directly impacting where you need your cervical curve to be.
Mm-hmm.
The reason why we put ice there is to make sure that it doesn't cause more inflammation, does more harm than good.
That's right.
And so we get you through that portion of your therapy, of your treatment. And once you really get used to that cervical traction, then we will put you to phase 2. And there's a couple different things that we do regarding that, like no headaches. You're able to get up to 10 minutes without having severe neck pain. And then aesthetically, your ear is over your shoulder without us telling you to do so.
That's right.
Yeah,
So we're
it's-
just repositioning your head.
That's exactly right.
That's what
So
we're doing.
cervical traction is designed to give you better posture.
And most patients have to like work up to that, right?
Yeah.
Yeah.
Oh, yeah.
Yes. Yeah, so even after we get done with cervical traction phase 1, now some people won't make it to phase 2 until they go to maintenance care.
Right.
Other people will get there a lot sooner.
Right.
Just because of how well they're doing, how well their neck is taken to the exercises and stretches that we've given them to assess and improve their posture. If you have better posture throughout the day, overall you will be using less energy to stay healthy.
Right. You could talk for 4 days about the
Yeah.
things that good posture.
Yeah.
As aside from it, our moms liking it
Yeah.
and our grandmas, like
Yeah.
what it actually does.
And then the cervical traction phase 2, we use pettibone cervical
The
traction.
dental rolls.
Yeah, the dental rolls.
Dental rolls.
The dental rolls. We take that cervical X-ray from when you first started, assess where we need to put the angle of the dental roll, and then we go from there because we need to assess where the cervical curve needs to be most impacted.
Right. And again, it's that specificity.
Yeah.
Do you use ice for the phase 2 or no?
No, there is no ice being used. So
The-
people that really love the ice, really love falling asleep on phase 1, they don't get that necessarily
Yeah.
for phase 2 because it's much more intense.
Yeah.
You kind of want it to be warmer because it's more pliable and when you're making those changes.
Yeah, depending on where you actually want the cervical curve to be enhanced or moved to, it'll affect which size denny roll you'll actually use. So those are the two types of cervical traction. We've kind of moved stuff over and around on our therapy side.
Yeah, we're going through some growth spurts over there. We're trying to figure that area out.
Yeah, so wobble chair is right in front of Andrea's office and massage. And
Now.
then,
We added those pediatric tables, which were awesome.
pediatric tables, and then cervical
The
traction.
koala and the squid,
Yeah.
octopus.
Cervical traction is all the way over to your right side or south side of the building.
And there's a secret bonus cervical traction table.
Yes, if you're good, you get to be all by yourself. Or if you're bad,
Or if you're bad, right?
One of the two.
either way.
So the lesson is be bad.
Yeah.
Or be really good.
Sure, but that's, you know.
Be bad.
Yeah, so that's cervical
Cool.
traction in a nutshell.
What's
And
happening?
then, we have much more room for activities, and people are just loving the quality of care that we're giving here is unreal.
It is. We got space, and we've got time, and we've got like all the things that we need, you know. And it's a shame that we've managed to, the human race, has managed to concoct work environments that are 1,000,000,000,000% detrimental to the human spine. Like, you know, humans are not made to sit all the time, and they're sure as hell not made to look down. So let's get a work environment where they're sitting for 8 hours a day and most of the time looking down.
Perfect.
And then let's invent some entertainment devices where they're looking down even more.
Perfect.
Because every millimeter that your skull moves in front of your body, you have a concomitant linear increase in your carotid artery blood pressure, cerebral spinal fluid pressure, all kinds of other weird stuff that you shouldn't be having. So instead of us painting these Picassos like we do in here, instead we're going to be short order cooks for the rest of our careers, moving people's heads back. Because it'll be the greatest yield for them, you know, in terms of, what's that field of philosophy where it's like, is the greater good for the most amount of people. That's what we should do. It's got a name. I'll think of it. Anyway.
Do you want to talk about wobble chair?
I'll talk about the wobble chairs for a second. The other weird thing that's over there is the three of them. I'm sure we'll order more. They look like chairs that have been cut off, and there's like a pogo stick on them, and then it looks like a unicycle seat, but without the unicycle underneath it. You know, and
It looks like half of a computer chair without wheels.
there you go.
No arms, no back.
Yeah.
There you go. And so those things do two things. The very first thing they do is they attract every child that comes into the practice to come over there and sit on them and fly off the back of them. That's right. The other thing they do is that they force the person to use their pelvis to keep themselves sitting upright. And that may seem easy, but if somebody's had a back pain for a while or back injury or some other subluxation or misalignment or something going wrong, they're not using all their core muscles correctly. And you have to re-educate them. You can't just hope that they'll do it. So we first fix their problem, but then, and as important, we correct the way that their body works. And that's what's super cool about wobble chairs. So when people sit on it, the first time they're like, this isn't doing anything. And then the next day they come in holding their guts. They're like, oh my God. But wobble chair makes you very strong in your core, which is really important. The data surrounding wobble chair, there's a lot of preliminary studies right now. There's nothing as concrete, no good longitudinal assessments are out there yet, but they are coming because it's being studied. The other really cool thing about wobble chairs is that some schools have taken the initiative of putting kids in these chairs. You know, they call them wobble or wiggle chairs, and it just gives the kid's butt something to do. And so for those kids that are a little more high-strung, then these chairs give them something to do, and it helps them focus. So it's actually pretty cool. And, you know, promoting a better posture either through traction or wobble, or in our case, traction and wobble, that is just pays incredible dividends for the human spine because it promotes a lot more blood flow to the brain. And that upper corticated, you know, that high oxygen content of blood arriving to the brain without having to go through 50 hoops or getting pushed uphill. You know, you can think about it like you have a garden hose and you're going to run that thing uphill. You know, the sprinkler at the top is not going to be shooting out water nearly as far as if it was level. And that's what we're trying to do. Does that make sense?
Yeah.
You have like a garden, you know, and your garden's a big square and you can put your sprinkler in the middle and it hits the whole garden. But let's move the whole thing up the hill a little bit. That's what you're doing when your head comes forward. That sprinkler's not going to get that whole garden, and it's not going to get it as easily. And there's back pressure. We hate back pressure. So we work to eliminate that with the wobble chair and cervical traction. It's like they're unsung heroes because what those are is our way of following you around to work.
We're concerned about your posture.
We're gonna. That's right. Like we're sending ourselves with you by retraining your pelvis.
It's a window into posture. Really is the window into back pain.
And
in
it's super.
general.
Right? It's got such a bad rap. It's super boring to talk about. But like, if you can get somebody to sit up straight, you're doing more for them, as much or more than.
Yeah, sit up tall.
Like, what would you do?
not
There's
just
nothing like, let me set your broken arm. That is really important to set broken arms. But if you can help somebody sit up straight, you're warding off so many bad things. Anyway, that was my thing.
Yeah.
Is that it? We have more? We want to do more?
Well, I mean, that's there. We've covered.
Those three?
Yeah, we're really being. If you've
It's
been,
really
if
exciting.
you've been in this practice, you've heard us talk about posture and getting up every 28 to 30 minutes and stretching, doing any kind of warm ups. We've already had 2 people come in this week that said, "Hey, I actually started to do what you told me to do."
Yeah.
Whoa. And
They were pumped up.
I've noticed a big difference in my neck and my low back.
And then what do we do?
And we said, "Oh my gosh!"
We hug them.
Oh yeah, we hug them.
Because it stops us from strangling them.
Oh yeah, yeah. We go in for the strangle.
Yeah.
but
If
then-
we ever hug you, we're thinking about strangling you.
And we can actually hug them now. So.
Yeah. Yeah, that's right. That's right. That's right. It's good to see everybody's faces coming back, you know?
Yeah.
Kimberly,
Yes.
anything for the people? You didn't say much today, Kim.
I actually do have something. It's
You
not
say
anything
the
about
most.
these 3 topics.
We were just
but-
asking to be polite. Kid.
Well, here I go. I heard a patient tell both of you guys the other day that their child
Mm-hmm.
is running faster.
Yes.
And I thought that was the coolest
Super
thing to
cool.
hear.
Yeah, man. Humans, well, you know, you have to go all the way back to Australopithecans and then Homo erectus, you know, like humans got down out of the tree, started walking. Everything about their metabolism had to change to affect that. And so you have, at the time, competing hominids. It wasn't a successful chain. You had competing hominids, which is incredible to think about. A lot of people realize that. And the Homo sapiens won the bet. And that's because he could walk further and faster. The problem is that he required a lot more, a higher metabolism diet. Anyway, the human body is made to walk. The way the pelvis works, the way the knee works, everything. It's made to be unilateral, one-sided. And it has 2 problems if you're a doctor. One, if you do your exam on someone and they're not moving while you do your exam, you're doing a crappy exam.
Yep.
Number 2, any interference with a person's ability to walk to their spine anywhere is going to show up most of the time in how they move. So when we do our assessments, we look at how they move. And in that particular young man, his left sacroiliac joint was rotated posterior, most likely from blunt force trauma, which is a football helmet to the low back.
To the rubbers.
And all the compensatory stuff allowed him to walk. He wasn't ever in pain, but he couldn't run as fast as he should have been able to. That's the difference. And so Dr. Matt did the exam, figured it out, bang, 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 and now the kid's just an absolute lightning. And
That's
it's
crazy.
It's so fun. It's so great. When people do stuff they couldn't before, or when they do it better,
They notice it?
man, that's
Yeah.
healthcare, boy. That's the good stuff. Yeah, cool. Thanks for bringing that up.
Yeah, I thought it was really neat.
Yeah, she was pumped too.
Yeah, she was.
Yeah, she was hugging us.
Yeah.
We talked about how the spine actually works in spinal care class last night.
Oh,
As well, we talked about how the weight transfers from the top of the head down to the pelvis. And if those bones aren't aligned, if your posture isn't good, if your posture isn't in its most appropriate spot, then you're going to have time.
You're bleeding energy,
You're
Kim.
bleeding energy. So we talked about that as well.
That's cool.
Just
awesome.
to
All right.
tie it in, yeah.
All right. Dr. Fink, anything for the people?
No, I think we're good. I think this is going to really educate people on what all the other things.
What the
that
hell's
we
going
have
on
here.
over there? Yeah.
And so they can come up with
What's going
some
on
more-
over there?
Come up with some
Listen to our
more
podcast.
questions. Yeah.
Dude, you're right.
Oh
my God.
So there's been an increased. People are going nuts. It's like we're the Beatles, but we're not.
It is
With
pretty
our
intense here.
podcast,
We got,
it's pretty
Wow.
awesome.
yeah. We got a lot of.
Don't worry, we're tracking it, Kim.
Okay.
Dr. Maurer, anything for the people?
I don't think so.
How you feeling, bro? The people are excited.
I felt
You
like
are getting quick.
I felt like last
He
week.
is. He's
last
coming
week
on.
was my biggest jump
Yeah.
because before that, I was talking about it as like a couple steps forward, but then I would have a day or a week even that just wasn't as good. So now I feel like as of last week, I'm making bigger strides.
Yeah. I've noticed stuff showing up in the desks again. And I know
Oh.
that now you're moving around a lot faster.
I see.
Because now the pranks
Oh, you think that was me?
the pranks are resuming. The pranks are resuming. So I'm like, oh, he is feeling better. All right, very good. Okay, cool. All right, so for Dr. Maurer, for Dr. Matt, for Kimberly, we will talk to you in 2 weeks. Thanks. See you later.
And a big thank you goes out to Hug Monster Sound for somehow allowing the doctors' voices to sound even better than they already do.